The number of COVID-19 cases has declined in Mexico for 3 consecutive months. Local authorities are beginning to reduce sanitary measures while the national government has increased its capacity to administer vaccines to deal with SARS-CoV-2. Our correspondent Eduardo Martinez with the details.
19 vaccination sites have been set up in strategic locations with a high influx of people. In Mexico City, people can request to be vaccinated at the subway station or in a grocery store.
It is good because if you don't want to get vaccinated, it is your problem. Being now more accessible is good. For example, I didn't waste any time or spend money on transportation.
300 sites have been set up by the government of the Mexican capital, which announced the end of sanitary measures such as the use of sanitizing mats or the taking of temperature to enter or indoor places.
At such low COVID levels, it is considered that temperature taken is not necessary, and what it is left is the requirement to use masks and gels at the entrance of public places. That is what the Health Secretariat has considered so far.
The country is celebrating a 90-day downward trend in the statistics of the epidemic caused by the coronavirus. States such as Nuevo León have determined that masks should only be used in public transportation and schools. Meanwhile, federal authorities announced that vaccination is a determinant factor to keep the health emergency under control. 196 million doses have been administered in the country to 85 million people over 12 years of age. Meanwhile, the government is looking for pediatric vaccines in view of the refusal by the COVAX mechanism to deliver vaccines for minors.
Eduardo Martínez, Telesur, Ciudad de México.